I am Josh Greggain. I'm a family physician in Hope. I am now the longest serving family physician in Hope. I celebrated my 10th anniversary last month. I am the medical director of the hospital. I'm the medical director of the clinic. I'm a medical director of the other clinic we run in town. I'm also a part of the Division of Family Practice in Chilliwack. I attend these summits, and I am the lead physician for the Anderson Creek Outreach Clinic, which is, I'm sure, reflects exactly what many of you do out there already, which is all of those things because you put your hand up once in 2008, and here we are. I have no organizational or commercial bias. However, I do believe that rural family medicine in a collaborative, multidisciplinary, interprofessional model is the most gratifying medicine in the world and on the planet, and everyone should come and do it. And so I know I'm likely presenting to the converted choir people here. However, I hope that goes on video. And so, as Rebecca so eloquently said earlier, this is the place where we're doing most of this already. And although, yeah, there was a little bit of an affront to sort of say, you know, why are you telling me something I know already? I believe wholeheartedly we can sort of demonstrate to the province and to other communities how this can be done well. For perspective, I say that I'm in a rural community. That's true. However, when talking to my colleagues in Valemount or Prince George, they say when they drive across the mountains and land in Hope, they're basically in the city. And so I've had to change my language. I am in a rural community in a peri-urban area. For context, we provide services of hospital, hospice, emergency, walk-in, specialized services, palliative care, and a bunch of other things in a fairly large area encircled by this. And so I say that I do the clinic in Hope, as well as we do the clinic in Boston Bar. And so Boston Bar is a First Nations collaborative clinic, which I'll talk about in a few minutes. And so for those of you who know geography, Hell's Gate lives here. Oh, sorry. Right here. Oh, there you go. And so I do a clinic once a week, beyond Hope, through the gates of hell. Not everyone who lives in Spuzzum appreciates that joke, but that's how it goes. We have around 250 kilometers of highway we covered. That includes Highway 1, Highway 3, and Highway 5. We have about 8,000 people in our catchment area, including the population of Hope around 6,300 people. We also have then about 800 to 1,200 people in rural environments, the majority of them on First Nations reserves. This is our clinic. And so again, I had the opportunity to show the front door of my clinic. And the front door of my clinic is the best way I can tell you that we provide interdisciplinary, multi-professional clinics. And so there are currently 9 physicians in my clinic, 8 of which provide emergency service as well as family practice. One of our physicians provides residential care support. Many of our physicians have specific interests in different things that we've adapted to accommodate the situation in the community. As an example, we have a fairly aging population fraught with palliative care, so one of our physicians provides hospice and palliative care and consultation services. One of our physicians has recognized that fentanyl is not just a problem in downtown East Side, but it also exists in Hope, and so he has recently started up a methadone program being supported via telehealth in process, but primarily working with other collaborative clinics and specialist services that are outside of our community to try and bring the services into our community. We have 2 nurse practitioners. I attended the session here yesterday on nurses in practice, and I thought, wow, what a great idea. We've been doing this for 10 years. And so, you know, that's some of our way to be opportunistic. And so in 2009, when the health authority says, hey, would you like a nurse practitioner? We said, sure. Not sure what we're going to do with her, but let's work it out. And so she gets allocated to youth, mental health, and homelessness. And so she gets allocated to some of the most vulnerable populations, which we know as GPs are incredibly difficult to manage. And so she's been doing a collaborative clinic with one of our youth mental health workers on Tuesday afternoons as a drop-in clinic. And so we've taken the nurse in practice and put a nurse in practice. And so the other nurse practitioner we have is a geriatric nurse. And so she's an NP who does residential care. And so in 2012, when the NP for BC program came about, they said, should you apply? And we said, sure. And so we applied for an NP for BC program, which then got us another nurse practitioner who does residential care, outreach to the assisted living situations, as well as then primary care for primarily geriatric patients. And so Pre to the patient medical home, we have addressed some of the high needs vulnerable populations in our rural community out of desperation and out of this is what we have to do in our community. And so we have what I built, Doug, I hope you're listening, a precursor to the primary medical home and would be a great candidacy for the 20th community, the 20 communities, again. This is our hospital, and so I like to show this picture only because when I show the picture, I say this is it, right? We have 8 beds in the hospital, 8 emergency beds, which I know is common to what the rest of you are doing, but when I share this presentation or these pictures at the health authority level, they all go, wow, that's so impressive. And so we cover, again, a huge amount of territory, around 10,000 visits a year. If you've been through Hope, which many of you have, driving to different places, you know that you have to go through Hope. Once you leave Vancouver, whether you're going to Montreal or whether you're going to Winnipeg or whether you're going to Vanderhoof, you have to pass through Hope. And so every so often you crash your car and we fix you. This is our collaborative clinic. And so again, pre-FNHA, and so 2008, there was a real situation in Boston Bar or Anderson Creek where there was no clinic and there was no services being provided. As many of you know, these First Nations communities and the non-Aboriginal people who live in these areas are fraught with all sorts of troubles that you and I know of but don't live personally. Poverty, abuse, trauma, isolation, geographic and socioeconomic. And so we partnered with, and again, this was a health authority collaboration between, at that point, Health Canada, who built the clinic, the health authority, who then provided the nurse practitioner to try and actually go there, the health authority that provided the services for the administration, so the bandages and the services and the MOA services, and then we as the providers, or me as the provider, agreed to go up there once a week. And so on Wednesdays every week, we go to this clinic, which is 65 kilometers up the highway into a First Nations community to provide collaborative care to both Aboriginal and non-Aboriginal patients on Aboriginal land. In 2009, this was revolutionary, right? The fact that a First Nations band would support a clinic on their site that actually gave them the capacity to see both Aboriginal and non-Aboriginal was absolutely mind-blowing. And so for us, I can tell you, it's a community of about 800 people, give or take. We have successfully now had 2 physicians and 4 nurse practitioners cycle through there on a weekly basis, and we see about 1,000 patient visits a year from working from Wednesdays from 10 till 3. And so part of my ask this week was to talk about telehealth. And so part of the telehealth piece was exactly starting in this clinic. And so FNHA has a process to get pilot projects into First Nations communities, and so we used this clinic as an opportunity to say, there are patients who are geographically and socioeconomically isolated in this clinic, and we want to bring new services into the community. And so FNHA provided a telehealth machine here in this clinic, and Fraser Health Authority then provided a telehealth video conferencing machine in our clinic in Hope, and one eventually in the hospital. And so we're working towards this collaborative model of how you provide telehealth services in a rurally isolated community, even beyond the gates of hell. Just kidding. In 2016, we started to sort of offer some telehealth services, and what we discovered is that the patients of Boston Bar and Anderson Creek weren't really prepared to just sort of step up, turn the machine on, and do it on their own, because they had established a relationship with us over the last 8 years to sort of say, I would actually rather wait until Wednesday to see you face to face. And if you live in Boston Bar, or Anderson Creek, or Spuzzum, or North Bend, you recognize that you aren't going to get your service immediately like you would if you were in Burnaby. And so I tease the health authority at times. It used to be the motto of Fraser Health was providing services from Burnaby to Boston Bar. And so my point was Burnaby gets different services than Boston Bar. And so when you live in Boston Bar, you recognize that, and so you wait for Wednesday. And so we started to offer some services in Boston Bar, and people said, I would rather just come and see you on Wednesday with my, hopefully, just a little cut finger or med refill, and hopefully not your chest pain, right? So it does happen. On March 27th, the mountainside came down and blocked off the highway. And so for those of you who know that, just past Spuzzum, the mountain came down and the highway was closed off. And so we had been saying for about a year and a half, hey, let's use telehealth services, let's use telehealth services. And so the day the highway closed, the question became, are you going to run clinic today? And we said, Absolutely. We had sort of done a little bit of foray into some mental health services via telehealth, and we had done a little bit of drug and alcohol counseling from our Chilliwack group, and we said, great, why not use this for a primary care clinic? And so we saw 15 patients via telehealth, and so there's yours truly providing telehealth services to one of the elderly patients in Boston Bar. And the feedback was, this is actually pretty good. And so now, interestingly, once the highway's been cleared up, people are still more than happy to wait and see us on Wednesday face-to-face. But it's, again, sets a seed for how we can provide services to isolated rural environments, providing team-based care, whether that be mental health, primary care, or even specialist services. And so part and parcel to all of the services we're providing face-to-face in primary care, in the community of Hope, we're also working towards a variety of ways to transport people into our community, and I mean getting patients from outlying areas down into Hope, but more importantly, bringing allied services into Hope. And so through, again, funding through the Health Authority last year, we have assigned a health services coordinator who helps facilitate visiting specialists and specialized services. And so those services at this point include, in no particular order, prenatal care, gynecology, pediatrics, general surgery, orthopedics, physiotherapy, mental health services, and soon to be general internal medicine. And so by taking GPSC funding through the division and some funding from the Attachment Initiative for Inpatient Care, we fund a physical space in order to provide multidisciplinary interprofessional services in a collaborative manner for all of the patients in our clinic. And again, would be an excellent candidacy for the 20. To capitalize on another program that's just started up recently, and again, you all know the struggles of your paramedics out in your communities who sit there for days and days on end, doing not a lot of anything until they get a call for a trauma or an arrest or something. And so the program called the Community Paramedic Program is rolling up this year. And so we, through the help through the Health Authority, has assigned a community paramedic to our Boston Bar clientele. And so they're going to be in the community providing paramedic services, but also be able to do a whole bunch of home checks, blood pressure checks, all that sort of thing. And so I have by no means figured this out, how to do primary medical home in rural communities, but we've started on a journey of how to utilize different resources from other things. You've heard JPSC, you've heard community paramedics, you've heard GP for Me funding, you've heard all sorts of things, how we've utilized our resources available to us to help provide what I like to believe is exceptional care for the 8,000 people in my catchment. This is our commute. And so every week we drive to Boston Bar, and this time in particular was beautiful with the mountains and the trees. And so I'm sure you have similar pictures of your rural communities. And I, again, would put a plug in. If you don't get this on your commute, come on to Hope. We'd be happy to have you.